Simcha and Chaya Feuerman here, talking to you about the N word. Yes, the most dreaded and awful epithet you possibly could give to a client or family member, narcissist. And we want to talk about narcissism and particularly the appellation that some people receive as covert narcissists, where they're essentially being told and diagnosed by whether it's a professional or media, as oftentimes people decide all kinds of medical things based on what they read and see. Some of it's very valuable, some of it not so, where the person is being described as somebody who superficially is really very kind and moral and just and is a good person in their behavior, but their deep insecurity and their need for admiration can cause them to be either self-serving in subtle ways, so on the surface being kind or the hero, or being heroes to everybody, but then to certain family members, consciously or unconsciously cruel, not seeing them, not understanding them. And like many personality challenges, I don't want to use the word disorder because I don't like to see things from the lens of some type of permanent clinical diagnosis, but the fact is that many personality challenges are very hard to change, and so some people have appointed themselves experts claiming that they're incurable, but they said the same thing about a lot of other mental health conditions until a whole industry was made about being able to cure those things. So we won't call something incurable, we'll say it's very challenging. And the challenge, I think, is that really the family members, loved ones, what have you, suffer terribly from these individuals. And sometimes it takes them years, decades, even to recognize that that's what's going on, because they are superficially, or maybe somewhat more than superficially, very good people doing good things, perhaps famous people, perhaps recognized religious leaders or political leaders or community leaders. And so it a lot of times the family members will feel confused and maybe go through years of suffering in the relationship. And then finally, when somebody gives them this way of seeing things, and information is very powerful, all of a sudden something clicks and they realize, wait, this person is not so nice, this person is not so good, and actually they're very, in some ways, very disturbed or insecure or lacking in empathy. And what I wanted to talk about and for us to have a dialogue about is that it really is a very sensitive topic, because in truth, those family members have suffered terribly. That's a known fact. Another really not negotiable issue is whenever you're dealing with a personality, and I'll leave out the word disorder again, whenever you're dealing with a personality, the only tools that that person has to see the world is through the lens of their personality. And that even when they're confronted, or even when circumstances of life confront them, that they really have to work hard to change, because their relationships are falling apart, they're being accused of things. Maybe some people have already decided to cut them off in some ways. They only have their own way of seeing the world to look at it. And even as they try to, quote, be empathic, or they try to be less needy or less insecure, they might just use another layer of defense and effort to be good. Or they could use even the therapy. Therapy, by the way, is couples therapy is oftentimes contraindicated when you're dealing with a deep-rooted personality challenge, because the person can be intelligent enough to use the catchwords of therapy and emotions and empathy to twist and turn and even sharpen their tools, driving the other person completely crazy. So it's a very sensitive topic because of that. And yet, on the other hand, and here's the other hand is that any of these labels are not really describing a human being. Any psychiatric or psychological label doesn't really capture the soul, it doesn't capture the will. And even if we were to say that a person with a personality challenge and somebody with a covert narcissism has these features in their behavior, and the other features where they're being kind or generous or want to do good, or even the wish to be recognized and seen and be the hero, or wanting love or desperate for love, those, who's to say that that isn't less sincere or more sincere, and that maybe the ideas about IFS, internal family systems, could explain with a little more depth what's going on with persons like that. Because why is their, so to speak, good side any less authentic than their bad side, if there is such a thing?
Yes, it's saying that someone has covert narcissism and just putting that label on top of them is a very black and white way of seeing a human being that is made up of so many different complex parts, and it's not helpful. Maybe it is helpful in some situations, but I don't see it as generally helpful to put a label like that on someone, and looking at a human being in such a black and white way. Because if someone has narcissistic tendencies, that doesn't make them a narcissist.
So let's say, as a trained IFS therapist who's worked for many years with people and their parts, someone came to you and you got that sense. The person came to you and said, everybody's telling me that I'm a narcissist, and my relationship is on its last legs. My spouse doesn't even want to come to couples therapy because he or she has been advised that it's not even worth the time. It's all insincere. But I'm really suffering and I really want to work on it. And even as this person comes to you, you yourself wonder, do they want a quick fix? How deep are they willing to go? Um, how would you use IFS to somehow or another address the predicament that the person's in? Maybe somewhere inside them wanting to change, but also probably despite themselves, still, you can see in the room with you, they're probably trying to show how wonderful they are, and they'll spend the first half of the session defending themselves or something.
That's all true, and I would probably try to find out if they're interested in getting to know their narcissistic parts, and in a respectful and curious way, so they can understand how those parts interact with the parts of the people that they're in relationships with, and how those narcissistic parts affect the parts of other people that get triggered. And if they're interested in that, there's definitely hope. Um, some people might have a lot of defensive parts and um, not even get to a place where they're able to be curious about their narcissistic parts.
So I like that phrase that you used. It's something like they might have many defensive parts. So it could be all these kinds of layers that you have to somehow or another work through. And are they like the enemy? Do you have to fight these layers? Just go bash through the person's denial, just kind of gonna break them until they finally hit bottom and realize what an insufferable person they are?
Right. I always encourage clients to view parts in a friendly way, in a curious way, and to have a benign interpretation about those parts. That the part, whatever the part is, even if it caused them a lot of trouble, to view it as something that's trying to be helpful in their life, in their system, and not as an enemy. Because if you see a part as an enemy, then you're not going to be able to really show it the respect and honor that it needs in order to be able to get to know it. If it's an enemy, then you're not trying to get to know your enemies. Nobody's interested in getting to know their enemy. They want to just avoid the enemy, run away from the enemy. But if you see a part as a potential friend, then you want to get to understand them. You want to get to see really what it's about.
So I would want to hear more about that, but there's another thing that I'm reacting to, having worked with many couples. I can tell you that the other side, or family members in family therapy, the family members that suffer, they're going to say to you, being befriend the narcissistic parts, you're just encouraging their narcissism. You're just giving them more ammunition to see how wonderful they are and how terribly misunderstood they are, and they really just, if only people would know how good they are and how actually they've been so mistreated and not understood.
Totally true. And I honestly, I'm not doing that couples work that you do, so I don't really know how that would work, especially in the beginning of this type of treatment.
No, but I
Uh,
mean, even in, how would, if somebody asked you to defend, well, aren't you strengthening the narcissistic side by telling them to get to know their parts better?
No, because if we get to know a part really well and the part feels respected, and the part can lower its defenses and be honest about what it's been doing and how it's been trying to help, and then it could come to a place of recognition that, oh, maybe it doesn't really need to be doing this particular job right now in the person's life, and could like take a step back and do things differently. But it's gonna dig its heels in if it's not being treated with respect. No part is going to change based on trying to shoot it away.
Okay, so I'm a client. I come to you, and I tell you again, my relationship is in shambles. Maybe I don't even have another chance. My spouse or my child or my, yeah, either one, not even interested in coming to therapy. I'm being told that I'm a covert narcissist, and I open up with this very sincere pitch, and then I spend the next half an hour every which way. I just don't stop talking, and I just keep telling you all the things I do for my children, everything I've done for my spouse, and how I've been misunderstood. How would you go into that and get me somehow or another to be able to work with what must be, again, I would speak with some compassion, an incredible blind spot, an incredible neediness. Who uses up, who spends a half an hour of an expensive therapy session talking about how great they are? How is that going to solve anything? But that is what a covert narcissist might very well do.
I would say that you need to leave alone all the other people, all the relationships, because first we need to work on the relationship within yourself, within the parts in yourself. Do you want to understand what's going on inside yourself? All the different people that are inside you. Forget about your child, your children, your spouse. We may or may not be able to fix those relationships. What we need to start with is the relationships within
Okay, but I try
inside.
so hard, and if only my spouse knew, I I I really mean it.
So
and
right
and
now
and
there's
I'm
a
so
part,
unappreciated.
yes, there's a part of you that right now that is so anxious about fixing the relationships. Perhaps we can ask that part uh, to be calmer and see if it would be open to looking at all the parts together and seeing what's happening inside.
Okay, so guide me through, how do I do that? I don't know parts. I'm just telling you that people say I have a problem, and I don't. I think I hear them, but it's a two-way street. How come they don't understand? You know how good I am, and anyway, half the time they're so mean to me, and they don't do what I want, and it's just terrible.
Yeah. So when you think about this word that people are saying about you, covert narcissism, what does it feel like to you? Uh, if you could just go inside and see, like, what is that? What is this covert narcissism? What does it look like? Where is it in your body? See
Well,
if you
they
could
they
connect to
say
it.
they say that I'm need a lot of attention, need to always be seen as good, and that leads to not really caring about other people. But I really do. So what's that part of me? Yeah, it feels like a little boy, you
Yeah,
know.
right. Okay. So go inside and see where is this little boy right now?
But what do you mean? Where
Where's
is
the
he?
little boy? What's the little boy doing? How's the little boy feeling? Let's see what this little boy needs.
Well, I think he's coloring or something with a coloring book, like in the corner of the living room, and um, he's okay because he's kind of smart and entertained, but it's also kind of lonely. His
And is
parents are
he,
very busy.
yeah, is he aware of you?
But me
The
looking at him,
adult, yes. Looking, yes, being with him in the room.
so I'm going back in time. Is this a mental space? What am I doing here?
See if he's aware of your presence,
Well, he looks
because
up.
yeah,
And he wants to show me his coloring, of course.
right. So just let him know that you are his grown-up self.
Okay.
And how's he responding to knowing who you are?
I think he's like so needy for the attention. Like he's just thrilled. He's like crying or he wants a hug. I don't know. It feels like it's very, very, very needy.
Hmm. See if he can come outside of you and sit separately from you.
You mean like here now in real time? Like put him on the couch over
Yeah,
there?
see if that could work.
Well, he says he's very, very afraid, but if he sits right next to me, he'll be
Mm-hmm.
okay.
Okay. So as long as you could see him and he's separate from you, that
Okay.
might work better because you could interact with him
Okay.
when you could see him
Okay.
as a separate being.
But how's this going to help me with my life is falling apart? And anyway, it's not even fair. Can't you just like, you know, meet with my spouse or their therapist and say that, you see, I'm really trying very hard?
Yeah, so you have anxious parts that are very worried about the relationships outside of this room that are very important to you, of course. That makes sense. See if the anxious part uh, needs to express itself right now.
Okay, so
Find the anxious part.
I think that the viewers, just to go back out of role or in role, depends on what role we're playing. I think that the viewers don't need to see a full demonstration. I think that's a good example of, let's say, how IFS might be used to try to, address a narcissism. From my point of view, see, it's interesting. I was actually really surprised, pleasantly surprised, because I didn't think that you can get to that layer. I'm a big believer. It's a very different way of doing things. I look at it like that the relational aspects are so important, and the feedback from the spouse and being able to hear that feedback, is what I think is critical in shaping things. And yes, I do recognize how hard it is, because maybe those therapy sessions will be torturous, and maybe in some ways the spouse or the other relative, the significant relative, will feel like, how could this therapist even entertain or even consider the viewpoint or the longings or the defenses of this person? They're so distorted. Just leave me out of it, fix them up, and you know, let me know maybe in a few years if they're normal. And I sort of understand that. And maybe, look, there's no one size fits all. I do see how some people really have been tortured by that process. But at the same time, to me, like the feedback is so critical, because how can you really develop empathy? How can you really develop an awareness of if you are coming across in this narcissistic way without the continuous feedback? Otherwise, it'll be like an echo chamber. How does the therapist even know for sure that the whole designation is accurate? Which I'm going to ask you about in a second. But what I was really impressed is that even though that's my approach, and it's helped, I think, quite a bit of people, but also, to be honest, I think some people have really suffered through it, because while so to speak, covert narcissist or whatever personality or diagnosis du jour is being applied to this person while they're working out their stuff. There might be many, many, many painful interactions in therapy, out of therapy, and even the therapist's own words could be used or distorted. Even so and so says, says you should judge me favorably, says it's normal. It's you have to always be compassionate and see the good or whatever, which I do believe, no matter what. I do believe that, but no matter what is a funny word. There's no such thing as no matter what. There are sometimes things that are intolerable, unacceptable, and maybe, beyond forgiveness. It's not my place to say who's beyond forgiveness and who isn't. But the point is, I was very impressed because even though that's the way I would go about it, I did see, wow, like this IFS stuff has something to it, because like I can see how the person could really like get calmer and more somehow more focused, um, to be able to see some of it. But what would you do? What would you say if like a person comes in and says, people say I'm, giving me these labels, but I don't know if it's true. I don't necessarily believe that. You have to tell me, what do you see? You're the expert. How would you, it's like, I find that always to be very difficult territory. How does anybody diagnose anybody? I don't like, how do you really know what's in the heart and mind of a person? Oh, you have this label. Doesn't matter what it says in DSM. It's made up by a committee of people who decide what's normal and what's not normal. And then all of a sudden, 5 years later, some most absurd thing is now declared as normal and acceptable. Well, what's going on there? So, like, how would you, to make a long story short, I would say, I like the IFS approach and how you might do this, but someone who says, I don't even know if I'm a narcissist. I don't know if I need this therapy. You're supposed to know. You tell me what I should do.
I would say, well, what is bothering you? Maybe you're not a narcissist, but is anything bothering you? Forget about what other people are saying. What's
Right.
hurting?
So that
what's
part,
inside that's
so that
hurting?
part would come out. Oh, they don't understand me well enough. Maybe sometimes I have a temper or I could be controlling, but they don't realize how hard I'm trying. And anyway, now I've really changed. Right. That would be kind of the song, that you would get.
Whatever's disturbed inside of them is what we would start with.
And
we
you would
don't
try
have to start with something that somebody else said.
And through the IFS, like the treatment rubric, every aspect of the personality is its own part, and then becomes like looked at and brought into a kind of a discussion. So you might have like 5 or 6 different parts in the room all talking to each other.
Absolutely, yes. Sometimes at a conference table, all getting a chance to say what they need to say, and some of them are introduced to each other for the first time. Some of them work together for a long time, and they're kind of like partners. And sometimes there are parts that are actually working against each other. They're adversaries. They're polarized, and we need to facilitate all the parts to understand each other better. The adversaries, the partners, the friends, all the parts should hear each other out.
They all got to work together and listen to each other, like a committee getting together.
Exactly. But everybody needs to work together.
So let's say, I know it's hard because everything is different and it comes organically from the client, but what might be another typical kind of part that would come up? I think you mentioned anxious parts, right? Would that be seen as a separate part? And then, like, what about the I don't know, like the people, like I said, the family members experience the covert narcissist as cruel oftentimes.
Yeah, well, I don't generally decide what parts are separate and what parts work together. I kind of like ask, does this part feel separate, or does this feel like it's the same part? Does this feel different? Does it feel like completely two separate parts, or does it feel like this might be the same part, or two parts that work together? I ask.
So basically, every dimension of this person's behavior that becomes a part of their personality is in some way looked at as its own, or you're asked to explore to see if it can be its own entity, and then each one is kind of talked about. So who wins? Does he now have all these different parts of the person?
Well, nobody's winning because we're all working from perspective of respect and curiosity.
But where's the self? Okay, so you got all these parts. Where the real person
So
stand up?
well, the self knows what is self and what is parts.
So they're not the same. So the self is not composed of the parts.
Right.
The self is something separate from all these parts.
Yes.
Well, that's a very important thing. So could there be a self that's so twisted and you know, narcissistic or in some other, like I said, whatever diagnosis du jour that they're throwing at people today? Is there such thing as a self that's so messed up that the self itself is the bad part?
Not the way I see it. Could be other people might see it differently, but I see it as the self being like the soul, and maybe the narcissism or the narcissistic parts could be so dominant that they kind of run the show, drive the bus,
So
or
how do you
kind of
get? And that's
hijack
very
the system. But
that's
that's
really
not the
good.
self.
That's really good. But what then? How do you get that right? So what you're trying to say is, and even though I have a different way of framing it, it really jives with my philosophy too. That right, that there's something that's beyond all these things. There's a soul. There's an essence that's unpredictable and can't be statistically or anything, you know, done with for good or for bad. It's unpredictable inside a human as anything. But let's say that's going on, right? So you got this all the parts then are layers, whether it's maybe even good parts too. Where so what do you call that in the end? If it's not the parts, what is it?
The self?
Yeah.
Oh, a person knows what is coming from self energy, from their life force.
So you're saying somehow in the process of the therapy, it'll be identified that there's a certain purity, a certain something that's beyond all these layers of defenses. And what do you do with this crazy dominant part, this giant, 1,000-pound gorilla that's making all the noise and causing, quote, all the problems? And some people would say, you got to break through their denial, beat them into submission.
Right. So I would do it the opposite. I would really hear them out and hear what needs to be said and what do they need. What does the part need? What are they so desperate for? And just be there for the part and just find out more and more and more about what the part is about so that it feels seen and heard and understood. And then it calms down over time.
Okay.
I can't give you a guarantee about narcissistic parts, but generally, with parts that are very domineering and active and controlling the system, if you give them some real, genuine, authentic attention and care, they start to calm down.
Well, so there you have it, folks. We're talking about the N word, the unthinkable, worst possible thing to call somebody a covert narcissist, and some perspectives that we hope, give people some ideas. Of course, some people are very, very difficult to live with, whether they mean that or they don't mean it, whether they're suffering or they're not suffering. They could be very difficult to live with. And with all respect to that, the solutions might be very nuanced, and here are some ideas about how to approach that kind of personality challenge, and probably using your imagination can be adapted to other personality challenges as well.
I'll say one other thing, and perhaps this should have been said in the beginning. This video is not for the spouses, the children, and the loved ones of the person who has these narcissistic parts that hijack the system. I think that this video is more for the person who is suffering from those domineering, controlling narcissistic parts who want to fix things, because
Yeah, keep going.
the
Sorry.
people that are suffering in those relationships from the covert narcissist is just gonna probably feel so invalidated and misunderstood. So really, we should have said that in the beginning.
The reason why I laughed, and I didn't mean to be disrespectful, the reason why I laughed is because it's so interesting because you're speaking from your perspective as an individual therapist, and I think exactly the opposite. That as a couples therapist, we don't have the luxury of of saying, "Oh, this is only meant for one thing." No, I want the spouses to see this. And yes, it really, really is awful. And maybe you don't want to be married to this person, and maybe you shouldn't. Those decisions are not up to me. Or maybe this family member is so insufferable you don't want to have anything to do with them. But if you want something that's the closest to what I believe to be the truth. I can't tell you anything other than what I believe to be the truth. I don't own the truth, and neither does anybody else. The truth is a free access resource for anybody who's willing to discover it. But what I believe to be the truth is that it's obviously very nuanced, and that you can really feel genuine hate for this person who's tortured you so much, and maybe even some anger and hate toward yourself for allowing yourself to be snookered and duped all these years. And so you might have very little patience. And for that matter, the person might be, despite their superficial intentions, may be extremely resistant and may not respond to any type of therapy, or even in this type of therapy, which I think is quite impressive. Who knows how long or what amount of parts would need to be fed. So you don't like it, or life is insufferable. You do have my understanding, but I actually want you to see this video because I still think it doesn't take away from the truth of the fact that you are dealing with parts or aspects of a person, but not the whole person, and that there's in overwhelming majority of people, there really is a good core. I suppose we have seen that there could be something that's truly evil, but it's not it's not a typical situation that one finds themselves in, facing, utter abject evil. Although, living in the modern world, we probably could say it exists somewhere, but it's not likely to show up in your office, or in a typical, family or communal relationship.
So you're saying that um, for the viewer who's maybe suffering with someone who they think has covert narcissism, and therefore like wants to just write them off, you know, maybe let's take an honest look at the parts as opposed to being black and white and labeling someone and like, okay, they're just evil,
Right, being clear, or they're just sick,
they're
or
just
or
evil,
they're
they're
broken
just
and
sick.
unrepairable. But again, that's different from what might be in some way psychologically true or even philosophically true. Doesn't mean that everybody has to suffer with everybody.
Right.
Uh, you know,
Everyone is
uh,
free to choose which parts they are willing to work with in themselves and with other people. So this is not to coerce or put pressure on people like, oh no, you have to deal with the parts. It's just parts. Like if you don't want to deal with the person's parts, the person's narcissistic parts, that is your choice to make.
or even deal with the person, because let's take something that's even more black and white. There are people with such strong addictions that effectively their recovery could be years, maybe decades, if ever, away. It's not their fault necessarily, especially certain types of addictions become just so overwhelming. They're just impossible. It's not their fault, but it doesn't mean that necessarily family members want to stick around, uh, and wait for this person that might recover. So it's talking about this from a hopefully a very holistic and broad psychological and philosophical perspective is not a guilt trip on the family members or the spouses. They have to stick around for these people. That's a very different decision, and I don't think we're in charge of those decisions. I think those are
That's
personal
right.
decisions. But information is information. So here we are, Simcha Chaya Feuerman here, talking to you about the N word, and we hope that you found this um, video to be educational, maybe provocative a bit, and helpful.